It used to be that the nurses, I guess, got together at the nurses' desk or area and talked, I guess, about the patient, what went on in the last shift before the shift changed for the new nurse. But lately, we were quite surprised and very happy with the arrangement of both nurses, the nurse that was going off shift and the nurse that was coming on shift, coming together to the bedside.
Well, when they come in first thing in the morning, they ask me how my night was or how my day was, and then the nurse that was with me that day starts discussing some of the things that I went through that day, and that informs the nurse on the next shift what's happening.
If I didn't have the nurses telling me, as they're telling me today, and what's happening, this and that, I would feel that there would be several days that it would take for me to heal. It just brings me back to wanting to get nothing but better, better, better.
Before, when the nurses were giving the reports separately, we didn't have much input. And when the nurses come together, we have a good input, and it helps me to remember during the daytime some of the questions that I had. Because as I listen to them talking about what's going on, then I say, oh, right, and what about this? Because remember, this happened.
Oh, yeah, they always give you that opportunity to ask questions. There's never a slightness or whatever.
The nurse going off knew the case very well. The nurse coming on may or may not know the case. And so us asking questions, there was more of an opportunity or a desire to do that with that kind of transfer method than there was previously when the nurses just used to discuss the patient at the nurse's station on shift change.
Like for myself right now, I'm learning how to walk again after losing the weight. And every morning I hear, they're always saying, you're going to do it? Are you going to walk today? Are you going to get up and do it? And there's days I wake up and feel like I don't want to do it. But those words of encouragement, they get me going.
If I was there at 7:30 and I was there most of the time at the shift change, I got to meet the nurse as well. It was a good feeling on my part to know that the two nurses were taking that time with her at the beginning of a shift.